you change position too quickly, or when you sneeze or cough or laugh. We can often ease this pain fairly easily, and we'll discuss both medication and non-medication options for dealing with ligament pains like this. Other causes of non-urgent tummy or abdominal pain that a woman can experience when she's pregnant are linked to the effect of your hormones, like progesterone, which supports your pregnancy, on your stomach and bowels when you're pregnant. So I'm talking about conditions like constipation, excess gastric acid and acid reflux. So I'm talking about conditions like constipation, excess gastric acid or acid reflux, and trapped wind. All of these develop because progesterone relaxes the muscles in the bowel and in the stomach, so they're not working as actively as before, and it can lead to sluggish bowel activity, which makes you more likely to develop constipation, excess acid, and trapped wind. Now, have you heard of SPD, which is symphysis pubis dysfunction? This is another form of ligament and joint pain. It refers to pain and other symptoms that you might develop when the joint between the left and the right pelvic bone becomes a little unstable. Usually, these bones and joints are held in place by ligaments so that the bones can't shift or move around excessively. In some situations, like during pregnancy, those ligaments loosen so that the joint becomes flexible enough for the pelvic bones to widen during delivery. But this additional laxity and movement in the pelvis, even though it's for a good reason, can be painful for some women. And it could mean that your pelvic area hurts during your pregnancy, or while you're in labor, or after having the baby. The pain may come from the front of your pelvis, from the back, or from both front and back. While walking, you may even feel as if your pelvis is unsteady, a little loose or wobbly. Another type of tummy or abdominal pain that we consider non-urgent is Braxton Hicks contractions. And these are mild, irregular contractions that help prepare your body for the main event. They are sometimes called the pains of false labor, and while they can be uncomfortable,